And good evening, everyone, and welcome to this episode of the Ask Dr. MJ. Your health is important. Facebook Live, Instagram Live, and now YouTube channel live broadcast. I am Dr. MJ Collier, your host, producer, on-air personality, along with highlight my behind-the-scenes moderator, motivator, and call screener. We are here today to answer your healthcare questions. So thank you so much for tuning in. We appreciate you and welcome all who are on the YouTube channel. Tell all your friends, text people right now. Tell them if they have a question about a disease state, if they have a question about something that's going on with their health, if they've been diagnosed with something and not quite sure what that means, if they've been prescribed a medication and they don't know what it is, how it works, why they're taking it, then tell them to tune in right now. This is your opportunity to ask the doctor, ask Dr. MJ your healthcare questions. Again, we have an opportunity to talk to you about so many different things. And at the same time, we're going to give you great information in reference to going to our website, lipodrops.com. On the lipodrops.com website, you can also capture this live broadcast. But more importantly, there's information on there about various types of supplements that can boost your health, help boost your immune system, help improve your sex life, help improve your erectile function, men, help improve the quality, quantity, and intensity of your orgasms, ladies, help with menopausal symptoms. All kinds of supplements that can help you be the best you that you can be. Remember, Dr. Collier has 3 things that he recommends everyone starts off with. Male, female, young, old. 3 things. Dr. Collier's essential trio. Things that you should take every day to improve your health. 1, vitamin D. Vitamin D at 5,000 international units per day. A normal range on a vitamin D test, when we do a test in the office, is from 30 to 90. 9 out of 10 people are less than 10. Some people you can't even measure their vitamin D levels. So what does a low vitamin D mean? Low vitamin D means weak bones, weak teeth and poor dental health, unhealthy skin, unhealthy hair or loss of hair if you don't have hair, if you're losing your hair, and your immune system cannot function optimally. That means you are very susceptible to infections by various types of pathogens. There are viruses like the flu, the coronavirus, the respiratory syncytial virus, bacteria like strep throat, bronchitis, and pneumonia, and fungal infections like toenail fungus, vaginal yeast, jock itch for men, that itchy rash that's between your cheeks that you find that when you wipe yourself, it's just itching. So those are things that you can take vitamin D for. Omega-3 fish oil. Omega-3 fish oil is God's gift to inflammation in the body, and there are inflammatory disease states, like just being overweight is an inflammatory disease state. High blood pressure, high cholesterol, diabetes, each of those by themselves are inflammatory disease states. If you have 2 or 3 of them, you really have baseline continuous inflammation that is negatively impacting your health. And chronic inflammation, one of the number 1 reasons that we are seeing so much Alzheimer's disease and dementia as we age because of chronic inflammation. Then probiotics. Probiotics, God's gift to an optimal immune system function. They help with allergy symptoms to environmental allergens like trees, pollen, and grasses. Food allergies that you may not even be aware that you have. Eggs, milk, peanuts, all of those things. If you take probiotics, you will optimize your GI function and improve your immune response. So those 3 things, Dr. Collier's essential trio: vitamin D at 5,000 international units per day, omega-3 fish oil at 3,000 to 4,000 milligrams per day, and probiotics with your probiotic formulation containing multiple bacterial cultures at the billions of colony forming unit doses. Billions with a B, not millions. So if you have a product that only has 1 type of bacteria in it, and it's millions or billions, then that's not the best product for you. You want something that has multiple colonies so your body doesn't get overrun with 1 type of bacteria. That's what probiotics are, basically just good bacteria. So you want to make sure that you're getting a mixed population so that your body can adapt and be prepared for anything. So we're going to start off with expressing our sincere condolences to the members of the King family, Marty King, Dexter King, Bernice King, all of the King children on the loss of their brother, Dexter King. Dexter passed away at age 62, far too young from prostate cancer. He battled prostate cancer, from what I understand, for the past few years. Now, that in this day and age is a big problem because, one, a routine comprehensive physical examination that Dr. Collier recommends for all men. So, ladies, if the man in your life, that is your brother, your father, your significant other, so father, brother, significant other, those individuals, those men in your life, make sure that they are going to the doctor for an annual comprehensive physical examination that includes a prostate digital rectal exam and prostate PSA blood testing. One of the things that has happened is that the prostate cancer rates are actually going up after decades of decline. We were doing so well with prostate cancer and breast cancer because the screening tests allowed early diagnosis virtually assuring that you'll have a good outcome and with your treatment regimen, and you will be soon cancer free. Well, guidelines were released that said, oh, ladies, you don't need to get your mammogram every year. Men, you don't need to get prostate exams. Not only do you not need to get prostate exams every year, you don't need to get a digital rectal exam at all. That was absolute lunacy. And now we're living the results of that, which is skyrocketing rates of prostate cancer, later stage diagnosis, and poorer outcomes. So the death rate from prostate cancer is going up. And we have had so many breakthroughs in the treatment of prostate cancer. We understand the genetics of prostate cancer. We understand the differences in various races with prostate cancer. We understand how to treat it. There is even robotic surgery. Literally, a robot does the surgery to remove the prostate gland in men. We have hormonal therapies. We have biological therapies to treat prostate cancer. So many different ways that this can be done and treated. But you have to get screened. Men, you have to get screened. Ladies, make sure the man in your life, your father, your brother, your significant other, gets his screening for prostate cancer so that we can optimize our health. That is really what we are recommending. If you have a first degree relative, a father or a brother that is tested positive for prostate cancer, you need to be immediately screened. I don't care what your age is. One of the guidelines says that if a person is a first degree relative, then you should get screened at least 10 years before that age of diagnosis. So if you have a relative that was diagnosed at, say, 45 years old, then you need to be screened at 35, would be the recommendation. Dr. Collier's recommendation is if you have a first degree relative with prostate cancer, colon cancer, you start to get screened immediately. I don't care whether you're 16, 18 years old. If you got a first degree relative with colon cancer, you need a colonoscopy. If you have a first degree relative with breast cancer, you need a mammogram. If you have a first degree relative with prostate cancer, you need to be screened for prostate cancer, which will include a digital rectal exam along with a prostate PSA blood test. So once again, our sincere condolences to the King family. Dexter gone too soon. We want to make sure that everyone, again, takes this as an opportunity to recommit yourself to prostate cancer screenings and all the men in your life. Make sure that there's no problem with that. Okay. Holly, let's go to our call. Those that are tuning in, let's do our roll call. Okay, Sean, big time green. Thank you, Sean. You number one, my main man, watching from Monroe, LA. Audrey Ngalu from Douglasville and Louisiana, New Orleans, baby. Okay, Chris Goodjohn, good evening from Greenville, South Carolina. Thank you, Chris. We appreciate you. Okay, Gon Hagler. All right, hello to Hip Hop Doc. Dr. MJ Kai checking in from Savannah, Georgia, straight out of Bama. Makiba Boland, good evening, Miss Makiba. Thank you so much. We appreciate you for tuning in as well. Penny Roberts, hello, greetings from Henderson, Texas. We got Texas in the house, Penny. Sherry Gamble from Dallas, Texas. So 2 Texas tuning in right now. Okay, Chili Wheel from Stockbridge, Georgia. Chili Wheel, one of my main men. We're so glad to have you here as well. Ellen Upshaw, watching from Richmond, Virginia. Hi, Ellen. Thank you for joining us. Mimi Witcher, good evening from Tampa, Florida, by way of Atlanta. Mimi, thank you so much. We're looking forward to you. Estelle Oliver, Lisa James from Lithia Springs. Estelle, thank you so much. And Lisa. Jay Jewett. Hello, Janika Jewett from Birmingham, Alabama. B-Ham in the house, Magic City. We are so glad to have you here. Linda Everett from Warner Robins. Okay, a little south of Atlanta. Lots of friends in Warner Robins. Angela Shields from Dr. Ann St. Louis. Okay, still. Shanta Jackson from Corpus Christi, Texas. Thank you, Shanta. Okay, Devin Brooks watching from Toledo, Ohio. Devin, thank you so much. Great picture. Molly Mall. Hello, Jamal Amin from Stone Mountain. Hello, Jamal. Kalita Jones from Miami. Miami in the house. Okay. Kim Winters, good evening from Mississippi. Hi, Kim. Thank you for joining us. Deborah Bell, good evening. Deborah from Jacksonville, Duval, Florida. Duval, we're so glad to hear that. TJ, what's up, Doc, from Albany, Georgia. All right, TJ. Thank you so much. LaShawn Dillon, good evening. Another Mississippian tuning in. Thank you. Diane Richards from Henderson, North Carolina. Diane, thank you so much. Fred White, Fred from Orlando, Florida. All right, home of Disney. All right, Christy Kirkland, watching from New Orleans. Thank you, my favorite city. Okay, Timothy Shelman. Shelman checking in from Deerfield Beach, Florida. We got Florida in the house. Amanda Woods from Houston, Texas. All right, Amanda. Okay, Charlotte Morrison twin from Monroe, Louisiana. Okay, Charlotte. Carlos Ward from Douglasville. Hey, Carlos, thank you so much for tuning in. We appreciate you. Corey Smith from Houston via New Orleans. All right, we appreciate that. That must have been a transfer from the storm. David Holiday, Columbia, South Carolina. How about David? Moni Wren from Macon, Georgia. All right, Moni, we appreciate you as well. Bertha Point, good evening, Dr. Collier. Bertha, we're so glad that you have tuned in as well. Jennifer Walker from Savannah. All right, trying to get down to Savannah, get me some oysters. Chris Green from Chattanooga, Tennessee. All right, Chris. Jay Banks, Boogie Down, Bronx. All right, we appreciate that. Okay, Marcus Mitchell from Grenada, Mississippi. Okay, and Willeen Adams from Claremont, Florida. Tanya Franks from Wilmington, North Carolina. Tanya, thank you so much. Connie Lorraine from Chattanooga, Tennessee. Thank you, Connie. Emma Ernest from Little Rock, Arkansas. Now we're talking Midwest. There we go. Willeen Atkins from Claremont, Bertha Point from South Carolina. Okay. Lakina Key London from Fort Wayne, Indiana. Okay. Very good. Nicole Anthony Shavers. Hi from Birmingham, another Birminghamian. Thank you so much for tuning in. Okay. Shalita McKinney from Spartanburg, South Carolina. We are good to go. Okay. Kathy Davis Kendrick. Okay, Holly, let's get to the questions. This is the People Show. And remember, we are here to answer your healthcare questions. So if you have a question, 1,000 other people probably have that question. So we're glad that you are bold enough to tune in and put it on air so that we can share this with the listeners of the Rickey Smiley Morning Show, as well as those that are tuning in to the Dr. MJ YouTube channel, Facebook, and the Gram. Okay, let's do it, honey. King Petty. I was wondering what I can take for memory issues. I'm trying to be an IT, but I have a horrible memory and can't retain the info I'm reading. Okay, King Petty. There are some things you can do. One thing that helps improve brain function, again, the two things that I talked about, vitamin D and omega-3 fish oil. But you might need to change your study technique. There are different types of learning styles. Some people learn from reading. Some people learn from writing. Some people learn from listening. I have the ability, if I hear something, I can retain it forever. If I read it, I will get it most of the time. But if I'm listening to a lecture, sometimes I don't retain it. So it just kind of depends. But it's amazing how different learning skills, and there are ways to determine that. You can go online and determine what type of learner am I. And then you can find out what's the best way for you to maintain that. Trying to be an IT, you're not trying to be, you're going to be an IT, King Petty. I'm claiming that for you right now. You're going to tell me, I found out what kind of learner I was, and now I'm capturing information and retaining it. More importantly, I'm learning what I need to know, and I'm going to be IT king. Okay, King Petty, great question. All right. Carol Triplet Hunt, been taking Premarin for my hormones. They still are not helping me with my sexual issues. I had a partial hysterectomy in 2010. Okay, Carol, one, Premarin is kind of old school hormone replacement therapy now. There is new technology. That technology is called bioidentical hormone replacement therapy, BHRT. This is readily available in a variety of different places. Dr. Collier does this in his office. What happens is we do a special type of blood panel on you that evaluates your neurohormonal status to determine what hormones you're lacking in and what hormones need to be replaced in. Based on the results of that test, it's entered into a computer program, an algorithm. That computer then designs a hormone replacement therapy that is unique to you. So yours will be different from 10 other women in the room. Unlike the Premarin therapy, where everybody gets 0.625 of the Premarin, sometimes with or without progesterone. But a unique, custom-made, bioidentical hormone replacement therapy is what you need and will be life-changing. I promise you. It will increase your libido, makes your vagina thick and wet, so you're ready to receive, and your desire to receive goes up through the roof. So the great thing about this is that, again, it stimulates you sexually and makes you a more sexual person. You are sexually supercharged. That increases your cardiovascular fitness level, your overall well-being. You sleep better. So many different benefits. So look up BHRT or come see me. We'll take care of it right here in Atlanta. Okay. Thank you, Carol. Okay, Bacardi Faces. Hey, I just received your products. I'm unsure what ought to take it. If you could explain. Okay, the products, one, are each labeled exactly how to take them and when to take them. They are compatible. For instance, the omega-3 fish oil is taken twice a day, in the morning and in the evening. The probiotics can be taken one in the morning, one in the evening, or two together in a single dose. You don't have to eat to take the probiotics, just a full glass of water so that you dissolve the tablets. So the vitamin D, also one small tiny caplet one time per day. Now the vitamin D and the omega-3 fish oil are absorbed better with food. When there's more acid on your stomach, they're absorbed better. So you don't have to take them on an empty stomach. You don't have to take them with food. They will still be absorbed. They are just absorbed better with food. The lipo drops for weight loss go under your tongue. You put them under your tongue, you hold them under your tongue for 2 minutes, then you swallow, and you do that before each meal, breakfast, lunch, and dinner. So again, each product is clearly labeled, but instructions are also on the website. But don't hesitate to reach out to me directly, and we'll also be happy to work with you on that. And so some products you can take together. I take the vitamin D and the omega-3, and I take those after I take the probiotic. I take the probiotic first in the morning, brush my teeth, shave, then take the others. So you create an order that works for you. But again, all compatible, and also all compatible with any other medications that you may be taking. So no conflict or contraindications with that. Great question. Great question. Okay. Lamisha Desmook. Okay. I have edema and want to know how to get rid of fluid from my ankles and legs. I'm taking hydrochlorothiazide 12.5. Okay. That's a small dose, low dose of the hydrochlorothiazide. That may literally be all that you need. Edema is fluid collecting in the legs, particularly around the feet and the ankles. You've seen those fat ankles or swollen ankles that people can get. That tissue around the ankles and in the feet is like a sponge. When it's wet, it's tight. When it's full of fluid, it swells up like a sponge. And then you elevate your feet. And particularly if you go to bed at night, you wake up and your feet are small again, then that answers the question that it's just literally a gravity phenomena, and it's probably because you sit throughout the daytime. Also, you have to monitor your salt intake. So the intake of sodium chloride in particular, regular table salt, is highly indicated and associated with swelling and fluid retention causing edema. One of the things you can do if you still want to take in salt is get potassium chloride, which actually has a positive effect on edema and helps lower your blood pressure. Potassium chloride, sea salt, you affectionately know it as sea salt, very effective in giving you a salty taste. It takes much less than regular salt to do so. So taste it before you just give it a normal sprinkle like a regular salt shaker, and that will help as well. You may find that if you're sitting in a chair at a computer or at a desk all day, that is a big problem. So you need to get up. You've been sitting for at least 2 hours. You need to get up, take a few laps around your desk or in your workplace, or just get up and move, because every step that you take, the first step, you take a step, your heel lands first. You go up and roll up to the ball of your feet, and you can feel your calf contracting. That literally milks the fluid from your lower extremities, brings it back to your abdomen and your heart and your kidneys so that you can expel that fluid. Also, you may find that you start to swell up and retain fluid because you're literally not drinking enough water. So one of the things you can do is increase your fluid intake, particularly just water. Drink more of that. That will make you urinate more. You're urinating more, you're going to lose the excess fluid that you're retaining. And so it's a combination of things that you can use to treat that. But it's something you're going to have to be very strict about, particularly the getting up and moving around. If you're in bed, you put a pillow underneath your knees. You don't put your ankles in the center of a pillow because that locks your knees, tightens the muscles, and you can't drain the fluid adequately. You put a pillow underneath your knees that flexes the knees about 15 to 30 degrees. It relaxes all of those muscles, and you will find that that fluid will be gone in a very short period of time. So edema, again, it can be an indication of other things too that need to be evaluated. And from everything from congestive heart failure to lymphedema, where you have problems with circulating fluids. But sounds like this is the run-of-the-mill edema, and that you're being treated with the hydrochlorothiazide. That's one thing that will help. You can take extra doses if you need to, if you find that you're retaining more in doing so. But 12.5 usually will do it. That will be good enough, provided you do the other things, particularly the salt restriction. Great question, Lanisha. Okay, Guy Fam Ingram. What causes sticky mucus after I have a bowel movement? And is a hemorrhoid banding painful? Hemorrhoid banding is less painful than cutting the hemorrhoids out. Cutting the hemorrhoids out will be excruciatingly painful, and you'll have to sit on a donut for a few weeks, which can be very disabling. You can't sit down, and you'd be surprised at how often you want to sit down when you can't sit down. It's a problem. Sticky mucus after you have a bowel movement is almost standard. Mucus is necessary. It lines the intestines, the large intestines, so that the stool can slide forward and come out. And sometimes there may be excess mucus production as part of it. You can help with that by increasing your intake of fiber. That would be crunchy fruits and vegetables, or taking a product like my Lipo Cleanse. You go to the website, lipodrops.com, get the Lipo Cleanse, which is a detox and a fiber product. It is not a laxative, so it won't give you uncontrolled diarrhea, but what it will do is help control that mucus and also help you have large, easy to pass bowel movements that keep you detoxified, your body detoxified. So that would be the perfect product for you. I also recommend adding the probiotics. The combination of the probiotics and the Lipo Cleanse would probably be ideal for you guys. So go to the website right now, lipodrops.com, get those supplements, then give us a report after you've been on them for a week or two, and I can promise you that you're going to have marked improvement in what you're complaining about. Great question. Joan Miles. Hi, Dr. Collier. Can side effects of Humira cause severe joint and muscle pains? Usually, Humira, which is a biologic, is used to treat conditions that cause severe joint and muscle pains. So it's rarely a side effect of Humira, but as I tell people all the time, just because Dr. Collier says it loudly and with enthusiasm doesn't mean it's not happening to you. So if it happens to 1 out of 1 million people and you are that one, then the impact is 100%. So if you say, I take this medicine and it causes me to have severe joint and muscle pain, then that is a possibility you need to discuss with your prescribing physician. But if it is not the case, and it is the primary disease state that the Humira is being used to treat, then it may, as the Humira is working, it may cause joint and muscle pain, but then as you have been on it for a while, you will probably have less of that and more of a beneficial effect. So hang in there with that, but that's not the only option. There are multiple biologics now that are available. And so if the Humira doesn't agree with you for whatever reason, you can try one of the other options as well. But you can take, this is basically just inflammation. You can take an anti-inflammatory, such as Motrin, Advil, or Aleve. You can also add biologics like omega-3 fish oil, vitamin D, natural supplements such as turmeric, curcumin are very good. So some of the teas that they have tablets, they have capsules. This is going to require vigilance on your part to find a combination of prescription medications and supplements that give you benefit and help relieve those symptoms. So it sounds like you're dealing with an autoimmune problem, and that combination of things can give you great relief. Okay, John, thank you very much. Quentin Brown, I have diabetes. They prescribed me Rybelsus 7, comes in 7.5. My manhood stopped working. They gave me sildenafil, still not working. Anything you suggest? I had BP meds, Telmisartan 40. Okay, one, the Rybelsus does not negatively impact your ability to function as a man. It has no effect. The diabetes, you have diabetes and high blood pressure. Those two things are the problem. And so you control those two things. Now, the Rybelsus comes in 3 milligrams, 7, and 14. So getting the Rybelsus dose up to the maintenance dose of 14, which will lower and control your blood sugar. It will lower your hemoglobin A1C. It will decrease baseline inflammation caused by the diabetes and help over time improve your erectile function. The sildenafil 100 milligrams actually should work. You want to make sure that you're taking that in the appropriate manner. Sildenafil is generic Viagra. The problem with generic Viagra and all Viagras are that they are highly susceptible to food and alcohol. So you have to take them on an empty stomach, only about 15 minutes. So what oftentimes happens is the order of things is that you have a date night that includes dinner. You have cocktails, you have food, you have dessert. So now you got a stomach full of food and alcohol. You go home, you take the pill, and nothing happens for a while. It doesn't stop it from working. It just delays its onset. So let's say by the time you're getting ready like Freddie, it's 9:30, 10 o'clock. You try it, nothing happens. You go to sleep frustrated, your partner goes to sleep. All of a sudden at midnight, you wake up, your flag has been raised and you are ready, but now she got to get up and go to work in the morning, or she's just tired and you have missed the moment. So the medicine is not necessarily not working, it's just taking it appropriately. So if you're going on date night and you know it's going down, that's how I tell people, worst thing to do is to waste one of these pills. So don't take it unless you are pretty sure. I never say 100% because things can happen. But if you are, say 80, 90% sure that tonight is going to happen, then just take the medication on your way to dinner. The medication will last you 8 hours. So if you take it at 6 o'clock on the way to the restaurant, on an empty stomach, by the time you get there, it's in your stomach, out of your and into your system within 2 to 5 minutes if you drink a full glass of water. So it's gone now and will not be negatively impacted by food or alcohol. So now you can have your cocktails. Now you can have your dinner without worrying about whether it's going to work or not. It will be there to work. I promise you. This medication is very, very effective and it works wonderfully. And then the blood pressure medicine that you're on, the telmisartan, also has no negative effect on sexual function. The way the telmisartan works is that it blocks a hormone that makes your blood pressure go up under stress. If that hormone is not present, it literally doesn't do anything. So the analogy with this is that it does not bring your blood pressure down. It stops your blood pressure from going up. That's a very important and significant difference. And that's why it does not negatively impact your love life. But you also might benefit from something that helps your testosterone level go up. Our Lipo T product would be ideal for you. It helps particularly when you have diabetes and also when you have high blood pressure because you take it every day. It's not like the sildenafil that you take when you're about to have sex. This you take every day so that you build up a certain level of sexual physical fitness that you're always going to be ready. You can still take the sildenafil or the Viagra if you like. There's no contraindication of doing so. The Lipo T, you take 2 or 3 capsules every day after dinner and before bedtime. So anytime between dinner and bedtime, so you can have food in your stomach. It doesn't negatively impact the Lipo T, but this will be life-changing for you. Each bottle contains 90 capsules. That's enough to take 3 capsules every day for a month. You do that for at least a month, and then if you want to go down to 2 capsules a day, you can do that as well. Also, one of the things that Dr. Collier highly recommends for male function, I do think these are phenomenal products, and I do take them myself, and I do highly endorse the response that you get. Okay. All right. Thank you, Quinn. Kawisi Raleigh, I'm having this pain in my back, and now it went through my arm down and my fingers are tingling. The hospital gave me IV and some muscle relaxants. What do you think? Could be a variety of things. A metabolic, it could be magnesium or potassium. Could be you having muscle spasm. It's only going down one arm, then I'd be more concerned than if it's going down both arms. If it's going down both arms, then that is probably metabolic. Anything that happens on both sides of the body is usually metabolic. If it happens on one side of the body, it could be vascular. It could be a pinched nerve. It can be so many different things. A bulging disc in your neck can cause all those things. So what you don't have is a working diagnosis. All they did was treat the symptoms. So you need to be seen, get a thorough evaluation by your primary care doctor who probably would be able to treat this. and also rule out things like low potassium and low magnesium. You can take those supplements regardless, and you'll feel better regardless. And so for muscle spasms, one of the good things for muscle spasms is quinine. Quinine is the key ingredient in tonic water. Tonic water, readily available in any grocery store, as the same tonic water you use for gin and tonic, vodka tonic. You drink 6 or 8 ounces of that every day. That will help tremendously with muscle spasms, no matter the etiology. That will give you some benefit. And if you want to add vodka or gin to it, no problem from Dr. Collier. You can do so. Okay, great question. Okay, Nicole Anthony Shavers. What is the difference between a prebiotic, probiotic, and digestive enzymes? Okay, prebiotics are just that. They are substances that allow good bacteria to thrive, grow. It's kind of like, I guess you could say, putting fertilizer in your lawn for grass seeds to grow. That's a good analogy. Fertilizing your lawn for grass seeds to grow. The grass and the grass seeds are the probiotic, and then digestive enzymes are utilized just for digesting food, oftentimes associated with either pancreatic dysfunction or liver disease, where your body does not have the necessary enzymes that are needed. The most common enzyme replacement is a product called Creon, and the dose sounds phenomenal because it's usually like 36,000 international units of that to help, but it amazingly change digestive response is very good, and it doesn't cause any problems as far as how you feel. It doesn't make your stomach irritated or whatever. And so this is a problem in doing so. But prebiotics and probiotics, there are some products that contain both as a supplement. There are some that you take prebiotics, then you take probiotics. Digestive enzymes, if they have not been prescribed, it's not necessarily something I would take unless there was a real need to take it, and i.e. that is a systemic diagnosis is made by a qualified healthcare provider, either your primary care doctor, your family physician, your internist, or your gastroenterologist for the digestive enzymes. These terms are utilized, I guess you could say, haphazardly on some of the products that are being sold on the internet, etc. So not quite sure whether we're talking about the prescription enzymes or just some over-the-counter supplements. But again, something I wouldn't necessarily be concerned about or wouldn't take. But prebiotics and probiotics, I do recommend. I think that you get a better response with the probiotics if you use the prebiotics. But probiotics themselves, our product, the lipobiotic, contains multiple colonies of various types of bacteria, each at the billions of colony forming unit doses. So you'll get a mixed product that is very good for you and probably would be all that you need. Go to the website, lipodrops.com, look for the lipobiotic product and any other of the supplements there. Look at what your signs and symptoms are and what it is that you're trying to accomplish. And there's a product that will meet that need on that website. Go to lipodrops.com, LIPODROPS.com. Okay, great. Willeen Atkins, as a woman going through menopause, what is a good vitamin to take? Currently, I'm taking Women's One a Day and fish oil. Okay, Willeen, those are great products. One a day for women is excellent. And again, omega-3 fish oil at an appropriate dose. Again, but these are, I would recommend, regardless whether you're going through menopause or not. They help with inflammation and a variety of other things. But if you want relief of menopausal symptoms, then you might want to consider adding our Lipo-HERS product. Lipo-HERS, we have Lipo-T, the testosterone for men. We have Lipo-HERS, which contains a variety of different supplements in that it will help not only enhance your body's sexual response, enhance the intensity and quality of your orgasms, but also helps with menopausal symptoms. So that would be something that you can take. Make sure that your fish oil that you're taking is equivalent to a minimum of 3,000 milligrams per day. Most over-the-counter fish oil products are 1,000 milligrams. You need to take 3 or 4 per day. Our Lipo Omega has 1,480 milligrams in each capsule. So you literally don't have to take 2 of those. You can take 2 together, or you can take 1 in the morning, 1 in the evening. Again, better absorbed with food, but you don't have to eat to get them. And so as long as your omega-3 meets that criteria, and the way to determine if you have a quality omega-3 product is this. One, if you open the bottle, it should not smell fishy. Remember, this is basically just taking fish and putting it in a blender and squeezing out the oil. and then sometimes it's filtered and purified. Other times they just put it in a capsule. So if you open the bottle and it smells fishy, it's probably not a good product. And then if you look at a capsule, the content of that capsule should be crystal clear. You should be able to see right through it. If it's cloudy, and again, if it smells bad, this is a poor quality product, and it may meet the criteria, but once it's in your stomach, you're going to taste it. You're going to be burping up that fishy taste, and your breath is going to smell that way, and sometimes all of your body fluids. So if you perspire under your arms, your saliva will smell and taste that way. Your female organs will smell fishy. And that's never a good time to smell fishy, even though it's because you're taking a poor quality, low quality omega-3 oil. But the lipo omega that we have, again, ultra centrifuged and purified, crystal clear, does not smell fishy in any way, will not negatively impact your body odor or the odor of your body fluids. So go to the website, lipodrops.com. Good products there for you. Okay, Waleed. Belinda Harrison. I was diagnosed with arthritis in my big toe. What can I take? One, if you have arthritis in an isolated joint, it's usually a result of trauma. You kick something, you injured the toe, you stomped your toe, as they say. And this could have been a while ago, could have been years ago, but now it's coming back to haunt you. So that inflammation that was there is now causing the joint itself to become inflamed and sometimes to deteriorate and or even become deformed. So that toe may be not at an appropriate angle, and that's continuing to put extra stress on it. So primary treatment for arthritis, which is itis, means inflammation of. Arthritis is inflammation of a joint, or artho. So anti-inflammatories, first level over the counter, Motrin, Advil, Aleve. The Motrin and the Advil are like 200 milligram tablets. You can take 2 of them up to 3 times per day, every 8 hours. That will give you relief. Aleve is 1 tablet twice daily. So your pill burden is decreased, and it's very effective for joint pain and inflammation. Again, natural things you can do. The omega-3 fish oil, the vitamin D at 5,000 international units per day. Other supplemental anti-inflammatories such as curcumin or turmeric. Also, the mushroom product that we have, lipo shrooms, highly associated with decreasing inflammation. Good products as far as inflammation are concerned. So some of the things that you can do naturally. Okay, great question, Melinda. Irma Ernest, okay. Should a healthy man 75 be concerned with a PSA of 12? Been studied for a year. He's very healthy and active and takes no medication. What do you recommend to lower his PSA? Irma, this is what I recommend. 1, PSA can be elevated, usually due to increased size of the prostate. The prostate of a young man is about the size of a chestnut. As we get older, it can be the size of a plum. It can be the size of an apple. It can really get big. So if your prostate is enlarged at age 75, I'm 100% sure that the prostate is enlarged. We call this benign prostatic hypertrophy, or BPH. But one of the problems is when you have a larger prostate mass, you're going to have a higher PSA. Now, a PSA normally should be less than 4. If it's between 4 and 10, that is usually, not 100% of the time, but usually an indication of benign prostatic hypertrophy. When the PSA is greater than 10 and has remained greater than 10, then I would highly recommend a prostate biopsy to make sure there is no prostate cancer there. The PSA is not a cancer test. It is a marker, when elevated, that cancer could be present. And a PSA of 12 would definitely be at the level that I would want to get a prostate biopsy. You get a biopsy and it's negative, then you know it's not that. You don't have to worry about it. It's not going to change. If you get one that's positive, you get early diagnosis and treatment so that you don't end up being a casualty of prostate cancer because it was quote monitored and studied for a year. Because it hasn't gone up doesn't mean that it can't be a problem. But again, normally when it's between 4 and 10, it's benign prostatic hypertrophy. If we look at the averages, going up to 12 probably doesn't mean anything differently. However, it would be reasonable to get an ultrasound of the prostate as well as a prostate biopsy. So most urologists are going to recommend a biopsy when it's 10 or higher, particularly since it's sustained 10 or higher. One of the things Dr. Collier does, because it can be an indication of prostatitis or inflammation/infection of the prostate, is that I will treat for prostatitis, usually 2 to 4 weeks of antibiotics and an anti-inflammatory such as Motrin or Naproxen. Repeat the PSA. If it comes down, I'm willing to, particularly if it comes under 10, then I'm willing to watch and monitor at a frequency of every 3 to 6 months. If it doesn't come down, then we definitely want to get a prostate biopsy and or at minimum an ultrasound of the prostate. Probably more than likely a biopsy would be recommended. So again, it's one of those things we have to do at 75. We're healthy. We want to stay that way. We want to live a long and healthy life. And guess what? The best thing you can do for prostate health is frequent ejaculation, a minimum of 2 times per week. And that's not 2 times in one day. I would say spread them apart about 3 days apart. But ideally, 2 times per day is not too much. 2 times per week would be the recommended therapy. But you cannot do this too much. The more you do, the healthier your prostate will be. So that is the greatest prescription that I can give you. You're asking on behalf of the gentleman in your life. So that means you got to be a willing partner to help him with this. Daddy needs his medicine. Make sure that he's ejaculating more than 2 times per week. Great question, Irma. Kid basketball ball god. Do you know anything about anoxic brain injury and neurostorming and how to help a person with it? Well, anoxic brain injury is when your brain has been deprived of oxygen and literally in a very short period of time, a matter of minutes, brain cells starts to die. When the brain cells die, you get a false sense of security initially, but then the dead brain cells cause the brain to swell. The swelling of the brain inside the skull ultimately reaches a point where the pressure is too great and you start to get more damage because of the swelling in the brain. This is where you see where they literally drill holes in the skull or even remove portions of the skull to allow the brain to expand without getting excess pressure so that it will not do damage by doing so. This is one of the things that happens when a person has a stroke. They have a stroke, they lose brain tissue, they come back somewhat and do okay for a day or two. Then that dead brain tissue starts to swell and ultimately end up having a really bad outcome because of that. So you have to relieve the pressure in the brain. And then neurostorming is when the brain is trying to compensate for the insult and the injury by all kinds of different signals going out. And sometimes various neurohormonal pathways are opened up and you get inappropriate responses for, say, for instance, if you want your left arm to be raised and your index finger to be pointed, that's not what's going to happen now because we got neurostorming. So all kinds of things are going along those pathways. So the primary treatment, again, is making sure that there's no pressure on the brain. 2, steroidal therapy. Steroids are still the best for acute inflammatory conditions, and that's probably what they're going to treat with. And then just to see how the person recuperates, tincture of thyme. I highly recommend, again, omega-3 fish oil as a good systemic anti-inflammatory to help with that condition. And anything else, this is going to require a good partnership with the primary care doctor, the neurologist, possibly a neurosurgeon, and the patient and the patient's family, because the recovery time is going to be extended. But hopefully there will be recovery and that you'll be able to get to some baseline in doing so. All right. Great question. Stephanie, I'm 39, 340 pounds, have hypothyroidism and hypertension. Trying to lose weight to conceive. I lost 100 pounds with sleeve surgery. I'm fatigued, my hair's falling out, and I have something about blood pressure medication. What do I do? Okay, 1, get your thyroid under control. For thyroid disease, particularly low thyroid, there's a range of normal. Let's say this is low and this is high, and everything between my hands is normal. Most doctors will see that and they will say, okay, your thyroid is here, it's outside, it's on the low side of normal. Let's get it here. And then they'll stop. And they'll say, okay, you're back in normal range. But that's not where you need. You need to be on the high side of normal or optimized. So you need to push that thyroid to as high as you can tolerate and keep your thyroid, particularly your T3, which is the active thyroid hormone. The normal range is from 2 to 4.2. We want to get you right at 4 to 4.2. That will optimize your metabolism, make you lose weight. You will just melt. Not a single sit-up crunch. You don't have to starve yourself. Just correcting the thyroid disease will help with that. Controlling the blood pressure. Some blood pressure medications have been associated with hair loss. But if you've had gastric sleeve surgery, Sometimes because of vitamin deficiencies that are caused by that, you feel tired because you're anemic and your hair falls out. Number one cause of hair falling out is thyroid disease. Second is anemia. You have both because of your previous history. So you're going to have to spend some quality time with your doctor, your primary care physician, your family physician, your internist to get those conditions under control. You may need the assistance of an endocrinologist. This is not beyond most primary care doctors' treatment regimens. They know how to do this. Some of them just don't do it or don't want to. So you might need an endocrinologist in there as well. You did not mention diabetes, so I'm hoping that that's not a problem. Most of the time when you have gastric sleeve surgery, that is literally what's considered the surgical cure for diabetes. If you are diabetic, it goes away basically. If you are not diabetic, you don't become diabetic. If you're currently at 340 pounds and you lost 100, does that mean you were 440 and you're down to 340, or that you lost down to under 200 and now you're back up to 340? All of those are things that have to be taken into consideration. Stephanie, you're only 39 years old. You need a good partner. You need a good co-captain, a quarterback to help you steer through this healthcare challenge that you're having, because it can be addressed. At the weight loss center that I have called Ageless Atlanta here in Atlanta, we are specialized in patients like you. We will get you where you need to be. I have so many patients that have had gastric intervention. They've had bypass surgery. They've had gastric sleeves. They've had other GI procedures for weight loss, and they lost weight and were successful initially, but now they gained it back. We help those individuals, again, get back to a good weight for them, particularly when you have associated diseases like thyroid disease and high blood pressure. It's what we do. So again, there are the other doctors that do all of these things. And so you want to make sure that you're partnering with a doctor or a group of doctors that if you are working with more than one doctor, they need to be communicating with each other so everybody knows what's going on. That's why I say you need a good quarterback. You need someone directing your health care so that everybody's on the same page. Everybody knows what they're doing. Everybody's using complementary therapies and treatments, medications that work together instead of against each other. And everybody has the same goal and objective, which is to optimize your health. Stephanie, please let me know how this comes out. We appreciate you. Earl Greer, do you have a food list that would decrease the sugar intake? There are, diet plans called sugar busters, a variety of different things. Dr. Collier does not necessarily embrace diets to say don't eat anything white, don't eat any sugar, all of those things, because one, you're going to go back to doing those things. One, sugar tastes good. It's one of the things that we crave. It's also one of the fuel sources that we need. So you cannot really have optimal health if you are not really eating those things that are available in the usual and customary diet. What you need to do is to alter your metabolism and to make sure that the diet method that you're using helps. Utilizing our Lipo Drops Maximum Strength formula changes the way your body metabolizes foods. So instead of storing food as fat, you're metabolizing fat very efficiently and effectively so that you lose weight. It allows you to lose weight from places you cannot traditionally exercise it away from, like under your chin, across your back, ladies, in the bra area, the back fat, the outer arms, the outer thighs, the inner thighs, all of these areas that are difficult. Our catchphrase when we first developed the Lipo Drops was lose the muffin top with Lipo Drops, because it would target abdominal fat that you cannot fix by doing sit-ups and crunches. You can have a six-pack underneath 6 inches of fat. So it's very important, again, that you lose the fat in an appropriate manner. So the Lipo Drops Maximum Strength formula would be ideal for you, Earl, as well as our new product, the Lipo Nights. This allows you to continue to burn fat overnight while sleeping. It contains multiple supplements that help with the metabolism of fat. It also even includes melatonin. Melatonin, which allows you to get a good night's sleep, decreases that stress hormone cortisol. We've all seen the commercials that talk about how cortisol increases abdominal fat, and that is one of the things you definitely want to decrease. So that combination of the Lipo Drops Maximum Strength formulation, 1 drop of full under your tongue before each meal, breakfast, lunch, and dinner, and the Lipo Nights at night. This is a capsule. You take 2 of these at night before you go to bed, and you will find that your weight loss issue will not be an issue and that you not only will you not crave sugar as much because you won't need as much, you will want it on occasion, and that's fine. That's what you want to do. But a food list that basically takes you off of sugar is not what you want to do. Even if you're a diabetic, diabetics, I have to tell my diabetic patient, it does not mean you cannot eat sugar. You can eat sugar. You have to eat sugar. It's a part of the standard diet. So you're going to have to do that. But what we want to do is to make sure that what you're eating is the appropriate amount of sodium, salt, and sugar, and other carbohydrates that can be converted to sugar. So it's going to require a little education. There is diet information on the website. So go to the website, lipodrops.com, where they can talk to you. They'll talk to you about intermittent fasting, where it's really not as important what you eat, but when you eat it. So if you eat everything that you're going to consume within 1 8-hour period, that can be 8 a.m. to 4 p.m., 10 to 6, any 8-hour period that you choose, and you need to be consistent with that on weekends as well. And you will find that you will just literally melt. Intermittent fasting has become one of the biggest things in weight loss that we have discovered, because it changes the way your body metabolizes food, and your body metabolizes food much more effectively. The problem is most of us now, because of things like Netflix, etc., we're staying up later watching television, we're eating later, and then we're going to bed. And that is the worst combination to optimize your health, and the best combination to gain weight and turn yourself into a hypertensive diabetic. So we have to monitor what we're eating and when we're eating it. Okay, Earl, great question. Okay, Tanya Rivers Dinkins. Tanya from Chelsea, Alabama. My left knee really bothers me. Bad cramps on the left side. Had an x-ray found my knee is near bone on bone. I had 3 shots that didn't help. Will collagen help me? I don't want to have surgery. Thanks. Have a great night. Okay, Tanya, you might benefit from plasma-rich platelets injections. These are where they take your own blood, spin it down, take out platelets, and inject that, and that causes and allows your knee to regenerate itself. This is amazing therapy because it is literally the only thing that will fix what you have had. The shots that you have had, there are 2 types of shots that you can get. Most of them come in rounds of 3. They're just steroid shots that decrease inflammation in the joint, particularly the knee. Usually will contain an anesthetic as well to numb the area so it doesn't hurt as much. But it usually gives you some temporary relief, but it usually doesn't fix the problem. There's also an over-the-counter product that is amazing for bone and joint health. That combination of things contains glucosamine and chondroitin. One of the most common names is a product called OsteoBiflex. OsteoBiflex. You take OsteoBiflex twice a day, and it is literally, because of the things that are in it, one of the other things that literally allows the joint to heal itself. You can take x-rays today and then take that medication for 3 to 6 months and repeat your x-rays, and you won't even recognize the knee. It'll be totally different, totally improved. It will have healing in it, and that it just takes time. But for bone on bone, again, the usual outcome and endpoint of that is surgical. That means possibly a knee replacement, depending upon your age and weight and a variety of other things. That's going to be something we'll have to consider. But surgery is always the final option, and those are the things that you can do. The plasma-rich platelets, PRP injections. Just Google that, PRP. There are doctors near you. Used to be hard to find, but now a lot of people have learned how to do this, and they're doing it now. It is the biggest thing in joint pain now that you can do. But also OsteoBiflex, which is over the counter. You can go buy it right now. Any pharmacy, any drug, any drugstore will have it. Osteo, OSTEO, by BI-FLEX. There are other products that contain glucosamine and chondroitin as well. They just require you to take up to 8 capsules a day, and that's a lot. They also have it in cans. It comes in cans like Coca-Cola, but that is a lot. Imagine how much storage space you got to have in your refrigerator to have enough cans to take that product every day, and you have to take it every day. I recommend the OsteoBiflex because it has a higher concentration and fewer number of tablets, and it's easier to take. It's just more user-friendly. And I always have patients that have great success with that product. Okay, next question. Deborah Bell. Hey, Dr. Deborah Bell. My husband received seed implants for prostate cancer. Does that have an effect on the sexual partner? No, no effect on the sexual partner. They're not giving you radiation when they ejaculate in you. It's not that kind of an issue. It's very effective. And one of the things that I'd recommend for patients with prostate cancer, because it goes straight to the source of the cancer, it kills the cancer cells without doing any substantive or significant damage to surrounding tissues. So the amount of radiation is literally right there where they implant the seeds. The seeds are about the size of a grain of rice. And what they do, they will implant those seeds in a pattern, a linear pattern inside the prostate, depending upon where the cancer is and how it's dispersed. And so it is a very good treatment option, and one that I recommend first line because it has some of the smallest amount of side effects, such as erectile dysfunction, inability to control your urine, hold your urine, or excessive urination. So bladder leakage, all of those things can be complications of virtually any other treatment for prostate cancer. And it also can happen with prostate seeds too, but it's just rare that it does. With the seeds, again, low complication rate, high success rate in curing the cancer, and no risk for the partners at all. So you can continue to enjoy sex with your husband and not worry about whether it's going to be a problem for you. That is a great question, though. A lot of women ask that question. They don't think about it initially. But once the husband has the seeds and they are now functioning again and able to have sex, that little voice in the back of their mind start thinking, am I going to have a negative effect from this radiation? Is it going to cause me any problems? No, it is not. Perfectly safe and no problem with that, Deborah. Great question. So Tara Rashan, newly diagnosed diabetes, what can be done to avoid taking medication? Sometimes you cannot avoid taking medication, but there are various types of medication that can help tremendously. The most frequently and regularly prescribed medication is metformin, the number one most prescribed diabetes medication in the world. Comes in doses of 500 to 1,000 milligrams. People can take up to a total dose of 4,000 milligrams per day. What Dr. Collier recommends is the European model, where you only take a low dose of 500 milligrams, and instead of taking it in one large dose, you take it with each meal, breakfast, lunch, and dinner. This is very effective, very efficient. Metformin has the benefit of being used because of its anti-aging capabilities. It slows down the aging of cells, every cell in your body. And so in anti-aging clinics where people are trying to stay good looking and beautiful longer, metformin is one of the drugs that they use even in patients that are not diabetic. So one of the things you can do to benefit from that. The next level of therapy would be some of the newer drugs, SGLT2 inhibitors such as Farxiga or Jardiance. Those medications not only will lower the blood sugar, lower the A1C, they also have benefits for the heart and the brain. They help prevent heart attacks and strokes. So very good from that. And then the magic medicines, the GLP-1s, that's the Ozempic, the Mounjaro. They not only lower the blood sugar, lower the hemoglobin A1C, they literally make you lose weight up to 30 pounds per 100 pounds that you're overweight, the equivalent to a gastric bypass. So this is a non-surgical weight loss method that everyone is using. Stephen A. is using it. Charles Barkley is using it. Shaquille O'Neal is using it. Oprah Winfrey finally admitted that she was on the shots. If you see somebody that's had a dramatic weight loss, that's what they're doing and how they're doing it. So one of the things you can do. If you don't want to go through all that, go to the website, take medication, because weight loss will help with diabetes no matter what. Try our Lipo Drops Maximum Strength, our Lipo Nights, and get some weight off, and that will help you control your diabetes naturally. Okay, great question. That was our final question. Tisha, okay, we'll go to Tisha's the question. This will be last. How can I naturally heal from PCOS? That's polycystic ovary syndrome. I'd be extremely tired, low abdominal pain, and other symptoms as well. Trisha, amazingly enough, metformin, the medication I was just talking about for diabetes, is the number one treatment for polycystic ovary syndrome. Usually at a low dose, 500 milligrams to 1,000 milligrams once a day, will give you and relieve those symptoms. Sometimes you need additional hormonal therapy, but the metformin is usually more than enough. Just a lot of doctors don't know it and won't use it. Or the obstetrician, OBGYN, wants the primary care doctor to do it. Primary care wants the OBGYN to do it, because if you're not diabetic, they don't want to give you a diabetes medication. But some of the other injectable medications like Ozempic, like Mounjaro, Trulicity, Byetta, these classes of drugs will also help you control the PCOS symptoms and make you lose weight. So again, Google new treatments for PCOS, share that with your doctor, go in and tell them you want to be treated to relieve those symptoms that you're having, and you can do that. Problems with PCOS, weight gain, particularly around the abdomen and in the lower body, the hips. Also, hirsutism, hair. You get hair on your face, mustaches and beards. Also, excessive hair growth. And again, it can make it difficult or almost impossible for you to conceive and get pregnant. And pregnancy is one of the things to help improve those symptoms because the pregnancy hormones are much better for the PCOS condition. So those are things that we can talk about. Okay, Tricia, great question. Final question. Thank you so much for a wonderful evening. We hope that you enjoyed and that we answered your healthcare questions. Again, you can go to the website, lipodrops.com. There you can access the videos from these presentations. You can go to the YouTube channel, AskDrMJ, Ask Dr. MJ, on Facebook, on Instagram, and our own YouTube channel. But you can find all the information that you want on the LipoDrops website as well. So sign up, go to the website, find out how you can optimize your health. Remember, Dr. Collier's Essential Trio. Remember, vitamin D, 5,000 international units per day to optimize and boost your immune system function and all those other things. Okay, we'll see you next time. Thank you for a great evening.